we heard the agenda of the meeting, innovate, adopt, impact. Let me talk about innovation because I want to give a message here. My first request to those who wish to innovate, please co-create with health technical partners. Very often, and I review this, whoever sends me or I come across a product, AI product, I say to make a presentation. Some of you are at this point in the journey and never talked to a clinician. Some of you are right here and said, done, you got already award from somewhere. There's no connect with public. You have no idea that there's something known as sensitivity, specificity. At least today we are using those matrices. Tomorrow we may not. Please, it may be a clinician, it could be a biomedical scientist, it may be a microbiologist, it could be a clinical researcher, clinical trial person, or a public health person, and so on and so forth. Please, a pathologist, a radiologist, done the right things. So please co-create. Let's create pathways to co-create. Second, please appreciate that there is something known as demonstrating validity. And that is the efficacy level walks through the path of reproducibility, accuracy, specificity, area under the curve, positive predictive value, negative. This jargon will apply for some more time, but if you don't make us understand that this tool of cancer is 90% sensitivity, it means it misses 1 out of 10 cancer. Please appreciate what it means, and I'm just dwelling on that for half a minute. So you use a tool for cancer breast for me, and you tell me no cancer because I am those 1 out of 10 or 10%. I go home and come back to you after 3 years, but 3 months later I have a lump. Understand the price? You thought 90% was great. It may be great in another situation, but not great in every situation. These fundamentals are well known, by the way. These are clinical epidemiology, research methodology fundamentals. Please embrace them. Then there is a dimension of testing them in the real setting called effectiveness. And then, of course, you put it in the system and see whether it truly changes the lives or not. Also, in parallel, please be mindful of the law of the land, regulatory pathways, and so on, stating the obvious. What you need for all this to bring data together. And we have a huge journey in that regard. Creating new data, better data, machine-readable data is one dimension. But there are trillions and trillions of data sets or data bytes available all across in data sets. You will be hearing this in perhaps many other sessions. How do we bring it all together for solutions? And that's a big one where the silos have to be broken. And we wish to work in that direction so that we make it available to you all and say, okay, use it. Use it ethically, use it by the law, use it in an anonymized way. It's a huge challenge, and NITI in particular, we are working in that direction to bring the silos together. Data varies from the census data to HMIS data to the data which sits in the ABDM, data that sits in the environment. All this has multiple dimensions of health, and we need to bring it together to make a true difference. The other one, as I already stated, whatever is validated, and give me those 5 tools that are validated, we'll absorb into the system. We'll take them through the HTA, Health Technology Assessment, make it available as a public good, and even before that, through the regulation, you could be having it in the market. Adoption is very important. Countries that will adopt faster will do better than those who are laggards in adoption. We want to create a culture of adoption and the usage, and people should be ready to use training, capacity, ownership, and that is the work to be done. Above all, we join hands to measure the impact and refine the model even as we go forward. These are my quick inputs to you, and looking forward to wonderful discussion and guidance from you all as to how to refine our thinking and how we can work together to make AI for India happen, so that AI will help define India's future and AI will help define AI's future. Thank you.